you everyone for sharing. I work at Humber River Hospital, and we are developing an equity and inclusion strategy. So part of it is doing work with staff, but the other part is thinking about our social responsibility with the community.
Breaking it.
I'm sorry. So as I was talking, not to repeat myself, but I'm trying to see how healthcare and what your opinion is in terms of where a hospital like Humber River can be a partner to the community in terms of addressing the issues that were brought up today.
Okay, I would say, so not only am I a resident, but I do currently work for the city. And one of the things that we are working on is that violence prevention plan for our youth. A piece of that would be that tackling of that violence interruption and intervention. I think where a hospital can fit in is when we're looking at the treatment of our young people when they get to the hospitals, as well as whenever there are, whether it's a gunshot victim that comes into the ER, offering different supports while they're there, other than the police kind of standing there over them, if there's something else that can be put in place during that time, as well as the treatment of families when they walk into those hospitals, wondering what's happening with their sisters, brothers, nephews, cousins, just that overall customer service and treating us like human beings when we walk into a hospital when we're already facing some of the trauma from someone that has been affected by gun violence. And I think, again, with that sort of interrupters model, right now, if you're using what's been based out there, the hospitals are tied to other community services and assisting with that. So, like whether it's the mental health pieces, or again, like I said, when it's those emergency rooms, it's connecting. And I would very much like to connect with you in order to get some of that work done so that we can start tackling some of those pieces.
Yeah, I'll just add, I think, not to be a killjoy, but I'm always a killjoy. I think we need to be very critical and skeptical of equity and diversity plans generally, right? Because I think this gives us this perception that things are changing, right? So one, be critical. I know this is people's jobs, people gotta do their work. But what I would not want is the window dressing to change, right? So I just need to be racialized and diversified staff, which usually is not even racial or diverse, but anyway. So that might be one step. But also the idea, the thinking, the how you make up the idea of what health might be, right? Or harm reduction, or violence reduction, right? So I've been in the hospital when we've had brothers, community members shot. And the way they treat you is like, I would swear, but like crap. So if we're thinking about violence as a public health crisis, that means that all of those people that came in that hospital, family members, cousins, girlfriends, people on the streets, friends, community workers, those are all your patients. So when you come in, those are all you treat them with respect, love, and care. That's not even getting to the medical stuff, right? But then this the automaticity of calling the police. I know the health experts are here, so you guys can tell me, but I know that that's probably a policy. I just don't know if that has to happen right away until you've taken care of people, right? And then I've been in the hospital too when people have been shot, and everybody thought that person was a gang member or whatnot. Then it gets in the news, and then everybody flips the script. That's violence too. And that should not happen, right? That should not happen. Because they're all our sons and daughters, all of them. So I think about how the hospital can become a place, if it really wants to, a place of community, of love and care, of dealing with these people first, and then the policies and all that after. That can be as real as it can be for you, but I don't know in your role in the professional capacity. But people remember that stuff. They're not going to walk into a hospital and if they have mental health issues. Like I know people who tell me I'm not walking back into Humber. We have many stories about Humber from when it was at Finch. Many stories. I worked at Humber as a security guard. I tell everybody not to go to the hospital. Dead ass, I'm serious. I'm serious. When I was working there as a security guard, 100%. And they do. It's the same thing when they walk into schools. And our schools treat people like crap. So I'm thinking about just how we can humanize that space at the first point of contact. Because in people's lives, that's all they're going to remember of the healthcare institution. So I'm thinking about, I'm even living through those moments again right now, thinking about, I know those people's faces at Sunnybrook. I'll never forget those things. That's what I'm thinking about when I think about healthcare institution as being part and parcel of the community.
Thank you for the question, and I think it's important that you're here, but I wish the entire staff of Humber River could be in this room to hear what was said. Many times, people from this community go into the hospital. I'll talk about, say, for someone that has sickle cell, for example. Sickle cell is a disease that causes tremendous pain, and I know that I've heard stories of people saying that I was not believed when I said I was in pain. I was told that I was on drugs or I was mentally ill because they didn't believe me as a black person. Most of them, again, black male, unfortunately. You know, they're just assumptions made by the way people look. And I think until we can break those assumptions and those stereotypes about certain groups of people, we have to stop it. I've heard it personally. I've seen the way some of the intake workers treat